Fusion, the international science radio show.
Hello, Simon.
Hello, I'm a Professor of Critical Care Medicine at the George Institute for Global Health and University of New South Wales.
Can you please describe what is sepsis?
So sepsis is a life-threatening condition that occurs when your body's response to an infection, your immune response damages your organs and tissues, and untreated or uncorrected, it leads to organ failure and ultimately can lead to death.
It comes from an infection response from the body that's too strong.
Well, yes, it can be precipitated by any sort of infection, viral, bacterial, other microorganisms. The commonest causes are respiratory infections, and everyone's obviously aware of the COVID pandemic, and people who died of COVID were dying of viral sepsis with failure. It was basically a respiratory infection that then caused failure of multiple organs. And because people didn't have any sort of immune protection against COVID, that was the reason it was so florid and affected so many people. So whenever your body encounters any sort of foreign material, which includes bacteria and viruses, etc., it sets off an immune response, and you try to basically kill the invading organism, and you produce multiple cell lines are activated. You produce lots of different things. People may have heard of cytokine storm being mentioned.
Yes.
In relation to COVID, which is cytokines are things that we produce in response to some foreign material and other things, even tissue damage, etc. So those things, those responses are designed to keep us alive, but when they get it out of control or excessive, or what's called a dysregulated host response in terms of sepsis, they damage your own organs and tissues, causing obviously people to be very sick and ultimately die.
And sepsis has been known about for a long time.
Yes, yeah, it's gone by various names. The word sepsis comes from Greek. We are trying to encourage the use of that terminology rather than people talking about things like blood poisoning, which are inaccurate terms and don't. So using the right terminology is good. And that's part of our awareness campaign. Obviously, today is World Sepsis Day, the 13th of September. We try to raise awareness always, but we have a particular focus on it this day or even through the whole month of September. And we're encouraging, through working with the Australian Commission for Quality and Safety in Healthcare and having a national sepsis program, the sort of phrase of just ask, could it be sepsis? Because we know that all around the world, and Australia is not immune to this, because the early symptoms and signs of sepsis are very non-specific. They're the signs of an infection, and they can be very, very vague. It can be, for instance, an elderly person who gets sepsis may have a fall or may be confused, and they present to hospital, and there are many other causes, and so we're encouraging people to actually use that term, say could this be sepsis, and try to bring that to mind to prevent unfortunately, there are a lot of preventable deaths and disabilities because of delays in recognition of sepsis and delays in its treatment.
So it's one of those things that people have to really, particularly the doctors, have to be mindful of sepsis as a possible cause, not just the infection or the fall or the injury that's before them.
Yes, yeah, because it can present in a myriad of different ways and we have a very committed group. They're called the Consumer Partnership and Group at the Sepsis Australia, which is based at the George Institute. It's the Consumer Partnership and Advocacy Program. And they're a very committed group of people who are either been survived sepsis and left with significant longer-term problems, or have been bereaved. We have a number of parents who've tragically lost their children to sepsis. And some of the story people, for instance, having leg pain because they're developing an infection somewhere, and then obviously being a young person going to hospital, and the first thing that comes to mind is not that this could be sepsis. The first thing that comes to mind for any triage nurse or treating doctor in a young person with leg pain is a muscle strain, a ligamentous injury, or something. So we're trying constantly running education to raise awareness within the health workforce, but also obviously if someone presents to a health worker and says, could this be sepsis? It just puts that possibility up there where people might think, oh, I didn't think of that, but yeah, we better make sure it isn't, because it's a potentially fatal condition.
And if someone does come in with that sort of symptom presenting and they want to question that it is or isn't sepsis, how do they confirm that? How do they diagnose?
This is one of the issues with sepsis, is that there isn't a specific diagnostic test. It's not like a heart attack where you can do an electrocardiogram and see changes on that, or do a blood test like troponin, and they're fairly specific tests, or a stroke where you do a CT scan. It's very much a clinical diagnosis which is why we want a high level of suspicion amongst the health workforce. So it's a clinical diagnosis. And what we're doing with the Australian Commission last year, they published a national clinical care standard for sepsis. And the first component of that is not missing the diagnosis. And so our instruction to healthcare workers is that if someone presents with a new acute illness, or if they're in hospital, a deterioration in their current illness, and there is not some other obvious cause, then sepsis has to be considered, because it does present in so many non-specific ways. And the diagnosis, sepsis is life-threatening organ dysfunction due to an infection. So you need to look for the infection. And obviously, we have many blood tests and clinical examination to say, okay, well, the kidneys are failing or struggling, or there are abnormal blood tests here. We encourage the measurement of blood lactate levels, because they tend to increase quite early, and certainly an increased blood lactate level and the degree to which it is increased is very closely associated with someone's risk of dying. So that's a very significant finding. It's not specific for sepsis, but if you have a raised blood lactate level and you're presenting to a healthcare worker saying, I'm unwell, there is certainly something significant happening and should be taken seriously.
So because it's caused by infections, so the first line of treatment is to treat the infections.
Yes, during the COVID pandemic, we did identify, because there was so much research done so quickly, which was a sort of collateral benefit, if you like, of the COVID pandemic, which was a disaster for the human race. But in terms of research, and sepsis research did demonstrate that you could modify the immune response with drugs to improve people's chances of surviving. But the early treatment is to identify the infection, which can be obvious if someone presents with pneumonia or an infected gallbladder or something that can be quite easily detected. Find the infection, treat it with the appropriate antibiotics or antimicrobials, maybe antiviral agents or antifungal agents. May require surgery. Perforated bowel, for instance, is quite a common cause of sepsis. And if someone has a perforated bowel that's spilling bowel contents inside their abdomen, they need surgery to wash that out and to repair the perforation. So So it's antibiotics, it's supportive care with fluids, drugs, may require dialysis, may require. And last 2023, there were 26,000 people admitted to intensive care units with sepsis, and the majority of those people needed some form of organ support, which would have been mechanical ventilation or dialysis or support, blood pressure support with drugs. So those supportive treatments, they don't cure the sepsis, but they keep the patient alive while antibiotics can work and while the body's immune system can also sort itself out. And that can be assisted by the use of early on immune suppressive drugs. Were successful in COVID. They haven't been proven successful in other sorts of sepsis, but they're still being researched. Corticosteroid, prednisone-like drugs, cortisone-like drugs that also have multiple effects, but also dampen the immune system. They look very promising in certain types of people with sepsis. And we're developing the ability to monitor that immune response through gene expression profiles. And doing that, there are a number of companies working on doing that as a sort of point of care test. So within an hour, you could take some blood and say, okay, I can categorize this patient as having sepsis with an overactive immune system. So immune suppression for them is a good treatment. But that research is ongoing, and we've still got a long way to go.
But it's promising. And with World Sepsis Day, what are some of the goals?
Well, a lot of it, we'd like to raise awareness. That's a very key thing. We've done a couple of surveys through the George Institute, looking at community awareness of sepsis, and it's not good. It's about 40% of people have actually heard of sepsis, and in terms of describing symptoms, it's depressingly few. Most somewhere around about 13-15% would say fever and shivering and shaking is a sign of sepsis, but other things like not producing any urine, cold and mottled skin, mental confusion, they're only named as possible signs of sepsis by around 2% of the population. So on World Sepsis Day, we want to raise awareness of sepsis, that it's a significant health problem, what the symptoms and signs are, that you should not delay seeking medical help if you think you have sepsis, because every hour, once sepsis starts affecting your blood pressure, which it does, and your blood pressure starts decreasing, every hour's delay is associated with an 8% increase in the risk of you dying. So it's a very serious condition once that's happening. So we want to raise awareness. There's a lot of activities, and that's both community awareness and within the health workforce, because one of the other issues with sepsis is that many conditions, you go to hospital, you are treated by a specialist who is the appropriate person for that problem. If you break a leg, an orthopedic surgeon. If you have a ruptured gallbladder, a biliary surgeon will look after you. But sepsis, you can be treated by a multitude, almost anyone within the healthcare system, because you can have pneumonia and be treated by a respiratory physician, or the ruptured gallbladder and the biliary surgeon, or a gynecological infection and be treated by a gynecologist, etc. So we need to educate the entire health workforce. So that's a significant component of what we're doing. This year, we're running a thing called the Sepsis Challenge, which is, you can find on social media. You can do it yourself and on social media, and we've had a very good response to that in terms of penetration with celebrities and also people who have survived sepsis who tell their stories. And then the challenge is to say, I'm sepsis susceptible and susceptible to sepsis 3 times as quickly as you possibly can. Yes. And people are having, obviously it's a serious issue, but people are having a bit of fun in doing that and trying to do that quickly and filming themselves and posting it on social media. That's a very big part of what we try to do, like other disease-specific awareness days, if you like. It's predominantly an awareness, trying to make and getting the attention, which we have done reasonably successful, of government and those policymakers and people who are actually responsible for the health system, and making them aware of the resources that are needed. There's regrettably still a lot of preventable death and disability from sepsis, and anything we can do to prevent that through improved awareness.
It affects so many people around the world. Is it something we could be teaching in health classes in school, how to identify what might be sepsis?
Yes, we're keen on basically teaching it everywhere. And there are, yes, the Global Burden of Disease project, we got them to look at sepsis incidents and outcomes, and the data. There's some new data coming out because it takes a long time to collect this global data, but there's some new data being analysed now. But in 2017, there were an estimated 50 million cases worldwide and 11 million deaths. And over 3 million of those deaths were of children. So the very young and the very elderly are most at risk. People from socioeconomically deprived communities or countries are at greater risk because the health services and also the underlying health tends to be poor. So people who are taking immune suppressing drugs for the treatment of cancer and other conditions, rheumatoid arthritis and other things, they are at increase. So we know that there are particular high-risk groups. But having said that, even young, fit, healthy teenagers who don't appear to have any particular risk factors do unfortunately still get and succumb to sepsis. So it is a problem. So how do we educate everybody? That is, of course, always a challenge. And I'm only too aware that there are many things that people need to be educated about, but certainly some awareness that if you have an infection and you're starting to develop these signs, shivering, shaking, feeling like I've never felt this sick before, I feel like I'm going to die, not making any urine, cold and mottled skin, mental confusion, which you obviously might not notice in yourself if you have sepsis, but if you're living with someone or has an infection and starts not making sense or looking a bit confused, that's a very significant sign. And when we're dealing with young newborns or infants, it can be, again, things being floppy and unresponsive and not wetting their nappies and so on. These are the sorts of things that we would like people to be aware of.
And the sudden drop in blood pressure is one of those things.
Yes. Some people have a blood pressure machine at home, but you may not be aware of that. But it can manifest as all those other things that I've mentioned are also, at least in part, some of those and then if you go to hospital or you call an ambulance and they will measure your blood pressure and find it's very low. And I think one of the things about COVID was that people, when they measured people's oxygen saturations, that they hadn't felt very unwell and they were shockingly low. It is possible to have quite advanced abnormalities in these vital signs without really appreciating them, which is why high level awareness is very important.
People want to find out more about World Sepsis Day. Do you have the website?
Yes, there are a variety of resources. There's the Australian Sepsis Network, which is australiansepsisnetwork.net. There's also the Australian Commission on Safety and Quality in Healthcare, that their website. We are working in partnership with them on a national sepsis program, which produced the clinical care standard, is running awareness campaigns through this World Sepsis Day. And there are also state-based resources. For instance, in New South Wales, where I am, the Clinical Excellence Commission has a sepsis kills program, which was an ongoing program for improving sepsis care in hospitals. And again, on their website, they have resources. And we all tend to link to each other's websites and harmonise the resources. And Queensland and Victoria, Safety Victoria, etc., they also have programs and information on their websites.
Is there anything I haven't asked you you'd like to mention?
Not. I guess the only other thing that we've only really become aware of probably in the last decade. When I qualified from medical school a long time ago, and I've been in clinical practice for 40 years. And at the start of my career in intensive care, the mortality rate from septic shock was in the 70 to 80% range. Now we've brought that down to around more closer to 25 to 30%. But our focus on keeping people alive, which was obviously clearly the most important thing in the first place, we didn't pay an enormous amount of attention to the quality of recovery. So 40% of survivors will have significant ongoing health problems. And these are physical. Some people have to have limbs amputated because of gangrene from sepsis. So we have a number of our consumer partners and advocates who are quadruple amputees. So those sorts of physical problems are very obvious. Less obvious are the sort of cognitive issues and psychological issues, and people who can have quite significant periods of cognitive impairment. So it's not uncommon for us through our website to be contacted by people saying, I need help because I can't do my job, I can't think straight, I can't look after my children, I don't know what to do, I don't understand this, where do I get help for this? So there are some significant ongoing problems, and that again is one of our goals, is to develop better models of care and rehabilitation services for sepsis survivors, because they don't really exist anywhere in the world at the moment. And so it's very important to, and I think that's an important part of our work with GPs, for instance, to be aware of what's called the post-sepsis syndrome, which has been really not properly elucidated. Everyone, when I say everyone, probably not everyone, but almost everyone has heard the term long COVID. And there's recognition, because of the vast numbers of people affected in a very short period of time around the world, this has become recognized that people do have ongoing problems following COVID. The same is true of sepsis from other causes, and that awareness hasn't been there. And equally, while we're trying to work out what are the causes of long COVID and how do you either prevent it or improve outcome from it, the same is true of what we call the post-sepsis syndrome. So that has been neglected because, as I say, the focus has been very much on reducing the unacceptably and still unacceptably high death rate, and not paying appropriate attention to the quality of survival for people who do survive sepsis. So that's an issue that now there is, I'm pleased to say, a lot of attention and research being put into. So what can we do in the hospital to reduce the chances of that happening? And then how can we improve people's recovery from the post-sepsis syndrome if they do have it? Yes, that's an important component of this, not just stopping people dying, but making sure that the quality of their survival and recovery is as good as possible.
Simon, thank you so much for your time. I'll put all the links up on the website.
Right.
And hopefully people will be more aware and know when they need to call for an ambulance.
Yes, that's our goal. And thank you very much for the time and the opportunity to get the message out there.
Study science, because you will find in the study of science a richer, more rewarding life.